primary congenital glaucoma. This is a bilateral congenital condition affecting mainly boys, manifesting at birth or within first few years of life and due to developmental angle anomaly. It affects 1 to 5,000 to 1 to 10,000 live births. The incidence is 50 to 70% of congenital glaucomas. Onset. Infantile onset. First 3 years, 90% of cases. 80% diagnosed by first year, related to maturation of inner non-pigmented ciliary epithelium. Autosomal recessive. Chromosome 2p21 and 1p36 with incomplete penetrance. Juvenile onset. Diagnosed after 3 years of age or in early adulthood. Autosomal dominant. Chromosome 1q23, q25 mutation. GLC1A gene produce a protein called myocilin. TIGR MYOC related protein is responsible for 3% of primary open-angle glaucoma. Pathogenesis. Fetal angle configuration. Anterior insertion of iris root and ciliary processes. Ciliary muscle fibers are continuous with trabecular beam. Barkhan's membrane. Presence of mesodermal membrane over trabecular meshwork. Congenital absence of Schlemm's canal. Schlemm's canal is usually compressed, secondary to high intraocular pressure. Ocular complications of primary congenital glaucoma. Ophthalmos. Stretching of the soft coats of the eye due to high intraocular pressure. Corneal and anterior segment enlargement. Limbal ectasia. Cornea. Corneal enlargement more than 12 mm in first year of life. Corneal epithelial edema. HAP stria, decimate ruptures, circumferential or horizontal. Corneal opacities and scars. Angle. High iris insertion. Absent angle recess. Peripheral iris hypoplasia. Loops of vessels from major arterial circle seen above iris root. Tenting of peripheral iris pigment epithelium and thickened uveal trabecular meshwork. Lens. Subluxation, dislocation, and cataract. Late complications. Fibrosis of iris root and trabecular meshwork. Atrophy of ciliary body, choroid, and retina. Optic nerve cupping. Secondary congenital glaucoma. Congenital glaucoma with ocular and or systemic findings. Associated conditions. Corneal, microcornea, cornea plana, sclerocornea. Angle. Axenfeld-Rieger syndrome, 50% have glaucoma. Peters anomaly. Iris. Aniridia, iris coloboma, juvenile xanthogranuloma. Lens. Microspherophakia, lens subluxation in Marfan syndrome and homocystinuria. Congenital cataract, Lowe's syndrome, congenital cataract and glaucoma. Phacomatosis, neurofibromatosis when plexiform neurofibroma involves upper eyelid. Hamartomatous infiltration of the angle occurs. Sturge-Weber syndrome, clinical syndrome characterized by the face shows diffuse capillary hemangioma along distribution of trigeminal nerve. The meninges, capillary hemangiomata are present, leading to epilepsy. Choroid shows associated diffuse choroidal cavernous hemangioma. Glaucoma is present in 30 to 70% of cases. Mechanisms. Dysembryogenesis of the anterior chamber angle, childhood onset. High episcleral venous pressure resulting in decrease in aqueous humor drainage, adult onset. Neovascular glaucoma. Vitreous. Persistent hyperplastic primary vitreous. Retinal. Retinopathy of prematurity and retinoblastoma. Eye globe. Nanophthalmos.